do you want to mute everyone? And
I will
yeah.
if the speakers will unmute themselves when it's time. And I have started the recording. And I will spotlight the speakers.
All right, I think we're ready. Well, first I want to welcome everybody and thank you for joining us tonight for our Stages of Recovery update. And before we get started, just a general review of some of the Zoom rules, and that is, please keep yourselves muted during the presentation. If you have any questions, write them down. You can write them in the chat or just write them down, and we'll be fielding questions at the end of the presentation. Now, the task force did receive emails in anticipation of this meeting with very specific scenarios. Our hope is that the information in the presentation will answer your questions. However, I will be providing written confirmation regarding your request following the presentation. And we're always cognizant of your time, and we will try to wrap this up no later than 8:30. However, if people are still asking questions, we will continue to be available. We want to thank everyone for their continued involvement in our virtual services, in religious school, in our events and our meetings, and we are so grateful for your commitment to the success of our Kehillah. I would like to extend a special thanks to our Recovery Task Force members for their dedication to the physical safety of our community, their expertise and their sensitivity to the community's social emotional needs as well. Now at this time, I'm going to stop sharing my screen and I'm going to invite Rabbi Marcone to open our meeting with a Devar Torah.
Oh, my mother would be so proud of me as a doctor also. Thanks, Vivian. Judaism is all about creating holy community. We literally have an entire book of the Torah whose central focus is giving us a description of how to do that. Our worship has changed mightily from those days of the ancient temple, but the core principle, which is explored in the book of Leviticus, which we read during these very months right now, is all about creating holy worship, community, and gathering. For our ancestors of old, that meant coming to the temple in Jerusalem, and there was one temple, one place where we could bring ourselves together for the holy expression of God and to God. But we lived our day-to-day lives in communities. And because the physical human experience has not changed that much in 3,000 years, at least in terms of our bodies, the laws related to family purity and holiness are discussed, related to bodily matters, just as relevant today. What happens when a child is born is part of the conversation. What happens when a home is afflicted with some kind of illness is part of the conversation. What happens when there's a plague that breaks out is part of the conversation. And for each occurrence, there's guidance. There is guidance for communal and unified response. Times of isolation and quarantine are established. Protocols for re-entry and purification are set out. A home that has a disease on its walls is disassembled and brought outside the camp. And to whom do we look for advice? Curiously, indirectly, I suppose, but not God. We look rather to Dr. Cohen. Literally, the holiest person among our people sets up the Tzara'at task force, the skin disease task force, and determines proper guidelines, taking into account the well-being of the individual and the community. There is nothing in our physical lives the Torah or later rabbinic law is not willing and actually feels an obligation to address, sometimes to gruesome and potentially fetishistic detail. Alas, it was and is all in the name of creating Kehillah Kedosha, a holy community. And what does holy mean? Rashi explains that it means to be set apart, distinct. We've been apart for over a year now, and yet our developing a holy community has persisted and continued in light of the necessary realities of COVID-19. Out of a goal to fulfill the Jewish value of pikuach nefesh, saving or protecting a life, we have taken preventative and careful measures to keep us all safe. And now, life is allowing us back into some spaces and physically with our community. And I'm so grateful for our community, for our committee and their work as we determine next steps. Many thanks to Vivian Smith and all the committee members for their input and insight. And I look forward to what we do next. And at a minimum, I know this much. Our work to create holy community is just as necessary and relevant now as ever. We know that we could be together and yet apart from one another, emotionally and spiritually. We have learned this past year that even in our physical apartness, we have remained emotionally and spiritually connected. May we go on in strength and with meaningful opportunities to carry on our work as a Kehillah Kadosha, as a holy community. Thanks.
Thank you, Rabbi. And I'm going to share my screen again, and I'm going to introduce Dr. Rob Rosen, who will review the most current metrics for Forsyth County.
Hi, everyone. I'm Rob Rosen. I'm in family practice here in Winston-Salem for the last 38 years, and everybody's tired of COVID, but those of us on the front lines are definitely getting tired of all this. We got this slide up here about the new cases. I got the numbers off the website today, and it's not exactly the same, but for the month of March, this slide's showing 712. The website I looked at just a few minutes ago showed 605 cases in the last 14 days. So I guess that includes a few more days. That works out to about an average of 43 cases per day for the last 2 weeks. So that's clearly coming down, because if you recall, at the peak, we were in a couple hundred cases per day. I know in my own practice, before things spiked, we'd see 1 or 2 cases per week. And as things got pretty dicey in January and February, we were seeing 2 or 3 cases a day. And we're back down to 2 or 3 cases per week now. Just today, there was reported 29 new cases, bringing the total of Forsyth County to 32,000, almost 33,000 cases. There's been 357 deaths in Forsyth County. And across the state of North Carolina, the positivity rate that I found was 5.8%. So that's across the whole county. It might be a little bit lower here in Forsyth County. I think there's one more slide for me to talk about this. Yeah, so this is actually not the daily cases. This is cases per month. As you can see, things really kind of got started at the end of March last year and started rising in April and early May, sort of leveled off at the end of the summer. Probably the second lowest we got was late September and early October. And then around the Thanksgiving holidays, and definitely by the end of winter holidays, things really took off and peaked after the first of the year. Things are coming down nicely, but we're still not, without cases. And, I can just go by the number of cases I've touched in the last week. And I've got 4 patients just in the last week that have been ill with COVID. So it's still out there. It's obviously not as bad as it was, but we're not out of the woods yet. I think that's all I got here, Beth.
Okay, thank you, Rob. Appreciate that. And just so everyone knows, this actually here from our peak in January to February is about a 60% decline, which is really nice. And this 400, that's more mid-March, and because I got this beginning of March actually, as of March 6th. So that has gone up a little bit, but still we've had a nice drop in the percentage. All right. At this time, I'd like to invite Dr. Steve Mizell to talk about the change in the CDC guidelines for fully vaccinated Americans.
Okay, so as you could imagine, because of the acceleration in vaccination, things are really beginning to change. So the CDC has made a number of changes. The first one is that individuals who are fully vaccinated can gather indoors in private homes in small groups with other fully vaccinated people without wearing a mask. And I think this is an appropriate thing, but not large groups and small groups. So if you're having another couple or two other couples over, I think that's perfectly fine now. Now, the next one is they say you can gather indoors with unvaccinated people from one other household without masks unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19. Now, I don't happen to agree with this particular recommendation as presented because first, if you have unvaccinated people and with these variants out there that are really problematic, um, I'm not so sure that's a good idea unless those folks have quarantined for 7 to 10 days before coming for that visit. And then secondly, they talk about that not with people who have an increased risk for severe illness from COVID-19. Well, the average layperson has no idea who has an increased risk. So I'm not sure this particular one is very helpful. So it requires great care. But I think if you have unvaccinated folks, if they quarantine for a week before they come for a visit, like children and their children, that should be okay. Can we go to the next slide? Now, what hasn't changed? So we still have to take steps to protect ourselves and other people in many situations. So even though you're vaccinated in public, it's a good idea to wear a mask. And gathering with unvaccinated people from more than one household is really not a good idea. And I've covered even with a single group. Now, visiting with an unvaccinated person who is at increased risk or lives with someone of increased risk, all of these things are really related to the fact that even though you're vaccinated, it's probably going to be highly protected. But because there are certain variants that may have greater potential to cause disease, especially in folks who have a concomitant disease like COPD or a heart problem, those folks, if they get infected, they might not have a serious infection, but unlike people who have no other problem, they could get very sick. So caution's really required, even though you're vaccinated. But if you're with other people who are vaccinated, you're generally speaking in a very small groups, good to go without a mask, but only in a very small group. Now it says you should avoid medium or large size gatherings. This is kind of useless because they don't define medium or large size gatherings. But my guess is medium means somewhere between 100 and 400, and large scale gatherings probably are political rallies or rock concerts. But it's anyone's guess. And then they're still arguing to delay domestic and international travel. I think this is particularly important given the environment within the airplane, because we've had many cases of people getting infected on airplanes and in airports. So I concur with that. Next slide. Now, what do we know? COVID-19 vaccines are indeed effective at preventing COVID-19 disease, especially severe illness and death. Now, you've heard about all the different vaccines and how they differ in effectiveness. The important point to remember is they all prevent hospitalization and death. And so if you're offered a vaccine that isn't your favorite flavor, don't worry about it. They all work the same. Now, that other prevention steps help stop the spread of COVID-19. And even with vaccines, we need to wear a mask, we need to keep our distance, wash our hands when we come in and out of the house after going places. And the early data, which is accumulating now, is that if you're vaccinated, you're unlikely to spread the virus. It doesn't mean you can't spread the virus, it's just highly unlikely. Now, what we're still learning, how effective are these vaccines against the variants? As I pointed out, we do know categorically that all of these vaccines prevent hospitalization and death. What we don't know is how good are they in folks who have other problems, and that still remains to be determined. We need to finish up determining how well or poorly COVID-19 vaccines prevent people from spreading the disease. And finally, how long is this protection? My own guess is that this time next year, we will be getting booster vaccinations with an altered form of the vaccine that covers one or more other mutants. Clinical trials have already begun on a mutant form of the spike protein that is the one causing most problems in Great Britain. And as you are all aware, there are also clinical trials going on in pediatric patients. So I think we're going to see, and they've been going quite well. So I think we're going to see pediatric use of these vaccines sooner than later. So with that, I will pass the baton back to Vivian.
CDC had put out those new guidelines that Dr. Mizell just reviewed on March 8th. On March 10th, there was this great article in the New York Times written by Ronnie Karen Rabin. And she wrote this article in response to those new guidelines for vaccinated Americans. And the very first quote up there states that this is welcome news. And it's the first time in a long time the CDC is telling us something we can do versus what we cannot do, which is wonderful. But, and there's always a but, note in the title of the article in parentheses, but start small. As she states, these guidelines are to nudge Americans onto a more cautious path with clear boundaries for safe behavior. And on March 5th, she had written an article that looked at the virus spread where restaurants reopened or mask mandates were absent. And the CDC researchers had found that coronavirus infections rose within 6 weeks post, and death rates rose within 2 months post in US counties permitting in-person dining or not requiring masks, according to Dr. Rochelle Walensky, the CDC director. The study did confirm that physical distancing may not be sufficient to halt the spread in some settings, and that masks at least partly block airborne particles. Now, to quote Dr. Carlos Del Rio, which is the final quote here on the slide, we're not turning a switch on and off, but instead we're gradually turning the faucet. And that is the approach we will be taking, a gradual reentry to communal life. And at this time, I'm happy to introduce Steve Zucker, who will talk about our revised stages of recovery guiding metrics.
Thank you, Vivian. It's always great to hear what some of the national publications and other authors are saying on this topic. I think it's very relevant. I know in my area of professional work, we're following what the CDC is saying and what regulators are saying very closely. And so it's always good to hear what others are saying. Before I talk about a couple of the slides that are coming up, I want to remind you what we said when we first met to discuss our guiding metrics. And if you recall, we said that this is a very fluid topic that will have several iterations to it. So here we go again. Here's another iteration, and it certainly may not be the last. But when we published the guiding metrics back in, believe it or not, June of 2020, so we're getting really close to the 12-month mark when we published these initial metrics, the vaccine was not even considered as a possibility. So vaccination was not a part of our conversation at that time. Thankfully, Operation Warp Speed was a success. It had a few bumps in the road, but I think today, we're very fortunate because we have not one, but several vaccines that are effective and they're out in the market, and there is increased funding to ensure the effective distribution of the vaccinations. We're also fortunate that both Forsyth County and our North Carolina Department of Health has really collaborated wonderfully to get shots in arms. And some of you may have been able to take advantage of the Department of Health's vaccination activities, but I think they've really been front and center. With that said, let's now take a look at what has changed between a year ago and where we're at now. We went from 4 stages to 3 stages, and I'll talk about that in more detail on the next slide. Our metrics not only include 60% decline with no upward spikes, testing and tracing readily available, and sufficient protective equipment, but also vaccines are readily available to all Temple members who are 18 years and older. And then quality masks are readily available. So, our combining of those metrics really made a lot of sense to us. In June, we had stages 2 and 3, which were a gradual reopening dependent on the decline in the metrics, wearing masks and physical distancing. At that time, we talked about 12 feet apart, and no singing and no owning, and a limit of 25 folks indoors and 35 outside. Our new guidelines combine stages 2 and 3 to 1 stage, which is now stage 2. Talks about having fully vaccinated members and their unvaccinated children attending indoor services. And what do we mean by fully vaccinated? What we're talking about is any adult over 8 years of 18 who's had a minimum of 2 years post second dose. And that's for the two manufacturers. J&J has come out with the most recent vaccine, and that has a little bit of a different twist in terms of what the expected efficacy wait time is for full efficacy. But we want to make sure that adults who are indoors with us have attended that, have waited that a period of time. So fully vaccinated members and their unvaccinated children can attend indoor services. We know that the vaccine is not available for children yet, and Dr. Mizell talked about that. There's new research that's found that, however, that this group, specifically children 12 and under, are really not as likely to transmit the virus. Non-vaccinated members may attend outdoor services, events, and meetings. And in both versions of the metrics, we really are we're continuing to discourage singing, and we will not be serving phone eggs. Because again, this is expected, unknown to be a airborne transmission. We'll be opening our doors for 40 people indoors, but again, when we talk about 40 people indoors, that includes the rabbi and the cantor and a board member. So we're really talking about 37 participants, and then 50 individuals outdoors, again, on a pre-registered basis. And our Temple board president, Hillary, is going to now share, what does this mean now that we've moved through stage 2? I see there were a few questions that popped up while I was speaking. I don't know if we want to hold those. Vivian, come back to those questions.
We're going to answer the questions at the end of the presentation. Thank you.
Very good. Hillary, thank you very much. Hillary, turn it over to you.
thank you, Steve. And before I start, I want to reiterate what Vivian said in her opening remarks about how grateful we are for the commitment of our recovery task force, their talent, wisdom, expertise, and dedication to bringing new information, being flexible. I thank you on behalf of the Temple community and the board. When the task force was first formed in April, about a year ago, we had 4 goals: to make informed decisions, to share with you, our Temple community, how we were making these decisions, and to reduce any ambiguity as to how and when we gather in the future. And finally, to determine best practices for when we do gather. We start each meeting, and we've had many, reviewing the current metrics for Forsyth County, the latest research, and we thank Dr. Mizell and Dr. Rosen for that. We've looked to the URJ and other Jewish organization recommendations. We've looked at neighboring Reform temples in North Carolina. We've considered the perspectives of our temple members, and most importantly, what Rabbi Mark referred to earlier, our Jewish values, Pekuach Nefesh. Our challenge, quite frankly, has been striking the balance between respecting the science as well as the social, emotional well-being and welfare of our community. And as you might expect, when you have a diverse committee with different levels of expertise, we often challenged each other, all to come to a mutual agreement and compromise on what those four priorities were that I stated just a minute ago. It was not easy. There was a lot of emotion and heartfelt desire to bring us all together. And we had to balance that again with the science and what was happening in our community. Our primary objective was always to keep our community safe and to consider the entire temple population in doing so. So with that said, let me share with you where we are now with respect to gathering and our plans going forward. And I think this deserves a drum roll. So yes, you're reading this slide correctly. We are going to have a gradual reopening, and I'm really excited to share with you our first Shabbat service will be Friday, April 16th. Why, you might ask, did we pick that day? Rabbi Mark and Cantor Jason will both be fully vaccinated. Our new guidelines state that fully vaccinated members can attend indoor services, and that includes our spiritual leaders. The logistics is the challenging part. We will be outlining them in greater detail. The task force is meeting again on April 5th, and we'll publish that in the Staying Connected email so that you can look at the logistics of how we will gather in the process. But here's a few things to keep in mind. Everyone will be required to wear a mask when on our physical property, whether you are in the sanctuary, in the lobby, or outside. Family units will sit together with at least 6 feet of distance, and we will mark off pews to every other row. We'll have an entrance and exit for the building to have an orderly fashion, and ask that there be no gathering in the social hall or parking lot. We will have a registration for members to register to attend service. On that registration, it's going to ask for when you had your second vaccination date or the Johnson & Johnson date, just so that we can confirm that everyone's had the full 2 weeks post second vaccine. There will not be an oneg. We won't have any events with food served indoors for any groups greater than 10, and preferably family members. And any food that is served will be individually packaged because we are going to keep our kitchen closed. On the outside, outdoors, now that we're having warmer weather, we can have up to 50 people gathering outdoors. And if there's food, we would ask for a 6 feet of physical distancing, and masks can come off only while you are eating. For those that are not vaccinated at an outdoor event, we would ask that their physical distancing be increased out of respect for the others that are vaccinated. We talked about religious school, and given that there are only a few weeks left, we decided to keep it virtual for the remainder of the school year, except for the last day. And you will hear more from Bobby on the school schmooze for details that he and Rabbi Mark are planning for a end of year celebration. So we are excited to start turning the faucet on and letting it gradually start to flow. We will continue to monitor the metrics, the vaccine rollout, and the progress so that we can look forward to gathering one day at full capacity without masks or physical distancing. But for now, I would ask that you share with the committee and everyone tonight on our celebration that we have a date, April 16th, to begin that reconnection. And with that, I'm going to turn it over to Vivian.
Keep forgetting to unmute myself. Thank you, Hillary. Well, like Paystock, we continue to journey together in the hopes of the promise. And so that's why I have the Passover window there. And at this time, we will try to answer your questions to the best of our ability. What I'm going to do is stop the share and we'll take a look at what we've got so far. Yes, Adam, you're correct. It's 2 weeks after the second dose. Does no singing include Rabbi Mark and Jason? No, it's just everyone who's within the space. The rest of us, we won't be singing. And that's all the questions that I can see in the chat. Does anyone else have any question? Just go ahead and unmute yourself. Yes, Amy.
Seeing that our son Benson will be bar mitzvahed on May 1st, are we talking now a capacity of 40 people inside? And how does that work in terms of people wanting to attend from Temple versus invited guests from our list?
So yes, we have 40 people that can come indoors for the service, but they all have to be fully vaccinated.
Mm-hmm.
All right, and past the 2 week. So
Correct.
yes, if you have people who you know who are fully vaccinated, then they would be able to attend. It would have to be, again, still following the same rules of sitting
Right.
6 feet apart and everything. Mm-hmm.
Will that also be open for Temple members?
Well, I think we'd want to give you the first pass to be able to invite your family and friends who can come. And then you can, if that's up to you then at that point, that you need to let us know how many spots are available.
Okay. With some of my family members, I'll have to have that discussion because in the planning, we've been doing basically 10 and under at this point. And everyone has been okay. So I don't want to throw them a loop. And my family in general has been very, very cautious. So I don't know that they would even like the idea of 40 people there. Maybe 20, but
it's your moment.
It's not mine, it's Benson's moment.
Benson's moment, it's your family's moment.
Yeah, we're very excited.
Well, good. We're excited for you. It's always a wonderful time.
Mm-hmm.
I think that I can at least touch on our HVAC system because that's something that we talk about quite a bit. Our HVAC system, and let me just say, that's one of the reasons why we have been hesitant in opening, because our HVAC system is not capable of, it circulates indoor air, it does not pull in outdoor air. And so that's a concern. And we all know that you want to have the air circulating, but you want outdoor air coming in and then going back out, pulling the air back out. So that's why it's really important that we make sure that we do wear quality masks. Double mask would be highly recommended. If you have a KN95 mask or N95 mask, that's also good, but the more filters you have, the better. And that's also why we are reluctant to allow people to sing, because that just would project more of your own respiratory droplets, and so that'll help contain it as well. In terms of the food, I guess I think you said The reason why we're not doing food and ONEGs is, again, because you would have to unmask to eat, and we do not want people unmasking. I hope I heard you correctly on that one. No, it was just for outdoor activities that we were allowing people to eat. And because unvaccinated people can also be at those outdoor activities, you just take your mask on for eating, make sure you're still you are physically distanced.
So I think it will be important to work with our custodial staff to try and get them vaccinated as soon as possible. And things are going to really explode in terms of vaccination opportunities with a real bolus of vaccine coming in. So we need to work on that. They will be wearing, I presume they'll be wearing gloves when they do cleaning, and they will be wearing a mask. So the potential of getting infected would be fairly low. But they would be aware of that risk. I would suggest that it would be also a good idea that, since you can get these things on Amazon, that we get face shields for the custodial staff. So if there's any liquid droplets from cleaning anything in the bathrooms, that would prevent them reaching their faces. So I think we could deal with that fairly comfortably with some good assurance of protection for them. And I think that's a good and valid point, but I think we can handle that, doing those things. As far as the children, Vivian, may I comment on that?
Yes, please.
So this has been an area, and we really want to be transparent about it, where we've had an intense discussion about where the cutoff is. Now, we know with very young children, the data looks pretty good, but they're not transmitted. Now, in facilities where people who work there got infected, it may be that they got it from some children, but it's also possible they got it somewhere else, because the data in school systems is not showing transfer to teachers from small children. It's just the data that's there. It's getting stronger. So what age works? Well, as you pass puberty, the potential to have a more adult-like response to the virus increases. There's no question about that. But one of the arguments that we used to try and reach a compromise was that, remember, if you have children up to the age of 18, that they're only going to be there because their parents are vaccinated. So that means those people have a commitment, presumably, to mitigating the spread of the virus and to doing everything possible. So I would argue that in those cases, the probability that those children are infected is extraordinarily low. But again, we're going to have a vaccinated group in the temple, and they will be wearing high quality masks. And again, you can get N95 masks now. They're readily available, not knockoffs. If you watch the Mavens talk I gave the name of a company, Demitech, that sells them. They're made in Florida. They've passed approval. So you can have good masks. So if we do those things, I don't think we're going to have any major problems with our guidelines. So I think you're raising those points is extremely important. I think we're going to be okay. Now, I know some folks have a hard time with those masks because they don't feel so comfortable, but in fact, the discomfort is worth it because they're very protective. And we talked about whether we would do some kind of demo, little video that would be available for how to put that mask on, because a lot of folks don't know how to put those masks on, and we can show you the right way to wear those. So that'll come up in our next meeting, but we can provide that. I feel very comfortable with the N95s because generally speaking, the way, if you wear it properly, it can handle very different face sizes. So they work well if you wear it properly. If you don't wear it properly, then I hear in your voice a sense, well, could that be a problem? It could be. But the key we want is, at a minimum, we want people to have a mask that has, at a minimum, 2 layers. And if you have a cloth mask with a pocket that's 2 layers, you can put one of those blue cheapo masks, cut it up and put it in there for a 3rd layer. those can work reasonably well. Now, the best, if you can't get an N95 or a KN95, are a mask that has a bridge, a metal bridge, so you can compress that area. But we can work with folks and make suggestions what's best. But I think since the KN95s and N95s are readily available, I would encourage everyone to get one of those.
You know, if there's a reported case, well, through the registration process, we will have everybody's names. We will ask people to please let us know if there's an issue after they've attended a service, so that we do have at least people's names so that we can touch base with them. That is part of the logistics that we will be working out on our April 5th meeting, is how we will make all of that happen. And then in terms of reevaluating our plan, we're constantly reevaluating our reopening plan. We're constantly, you know, my biggest fear, and especially the whole task force, is God forbid someone did get infected while they came to services. And then what happens if we end up being one of those counties that flips by, you know, and the numbers start going back up, then we will pull back. So, I mean, we hope that doesn't happen, but if we have to, we will pull the plug, and want everyone to realize that this is where we are at this moment in time, and the decision we've made at this moment in time. You know, 1 week before our, we had 2 meetings, one right after the other. And the prior week, we still didn't think the numbers were there for us to open. And a week later, with the change in the CDC guidelines and the numbers really taking a dive, we felt, okay, we can put our toe in the water and give it a try. So we're putting our toe in the water and giving it a try. But if the water turns really cold, we're going to pull our toe out. One of the questions I think Bobby had asked, I'm going to go back to the chat real quick. Bobby asked, what will be the cleaning procedures after services, especially between Friday night and Saturday morning of Benson's Bar Mitzvah weekend? And again, those are going to be, that's the logistics and the specifics that we will be talking about. So thank you for bringing that up. Let's see, how many people are allowed in the social hall at a time? And again, that would be a small group, is up to, and that was Wendy asked that question. We can allow up to, I think it's 10, I think we said. Is that right? 10 in a small group in the social hall. So Wendy, does that answer your concern?
So my question is, like, if we're getting ready for the auction and to have viewing, if we have things spread out on tables in different areas in the social hall, we can let 10 people in at a time if they're spread out and they're masked and they, you know, I mean, it's not going to be a rush of people, but we need to have clear sense of what we can do and what we can't do.
So think about who is going to be in the social hall already, and then you can have a total of 10 in there. So if you're in there and Karen's in there, the two of you, then you could have 8 other people come in.
Yeah. Okay. No, we would just have one of us at a time.
Okay. Yes, Dr. Mizell.
So, you know, we would also like to use this registration, from my perspective, this registration approach. So that would also help you in terms of times that people would know that they could come and be assured of getting their opportunity to go through. And we would be able to have that information that they were vaccinated, and that if anything ever happened, we'd have the records to do the tracing, as was pointed out earlier. So
I think what we'll do is have them sign in when they come. We feel like having people sign up for times, if you want names, if that's the point. But and do they have to be fully vaccinated? If there's 9 other people and I'm fully vaccinated, does everybody have to be fully vaccinated? And do we just ask them? I mean, is that appropriate? I mean, what's the guideline there?
Let me see. You know, Wendy, that's a really good question. And the task force is meeting again before you have your viewing. So I'd like to take that back to the task force, because right now, our guidelines is that you have to be fully vaccinated to be indoors for services. This is something a little bit different, and I don't know. We want to remain consistent in our practice. And so I'd like to bring it to the task force and then get back to you.
Okay, we're moving everything there Sunday, just so you know. So I'm not sure when you're meeting again, but
Well, we can also talk about it offline.
okay.
All
right, thanks.
Yes, thank you very much for that. I've got, let's see. Oh, to note, yes, thank you, Rabbi Mark. We will continue to have a hybrid process going on. We will continue to have live stream and Zoom, as well as people coming into the temple as of April 16th. In terms of the registration, again, that's the logistics that we will be talking about at our April 5th meeting, and you will get plenty of notice about that, I promise. Did anybody else have, Lindsay, did you raise your hand? Yes.
I just, out of curiosity, one more way to maybe consider reducing the potential of people acquiring the virus. It is my understanding that we still don't know the length of time that the virus actually survives on a fomite, in which case it's not likely that we're going to be fogging the inside of the shul. Would it be suggested then that we also maybe provide or have gloves? So again, reducing the chance of us touching the virus and then touching any open pore.
Go ahead, Dr. Mizell.
So the problem with that is, even if you're gloved, if you take your gloved hand, touch your face, your nose, or your mouth, it's the same thing. The key here is that when that virus touches a surface, it immediately loses its 1,000th as infectious. So although people could be infected by touching a surface and then touching their nose or their mouth, it's not the biggest worry. And so I think if we impress upon people, when you leave your mask on till you get home, go in, wash your hands for 20 seconds, then take your mask off. That's what I do whenever I go out. I leave my mask on, I come into my house, wash my hands, then I take my mask off. So it really doesn't matter about our surfaces, to be very frank, if you keep that mask on and go home and wash your hands. So, but we still will wipe things down, and that'll emerge from our discussion. But I think that's the least of our problems, quite frankly.
I see a question from Art. Art, you wrote, how likely is it that High Holy services will be live this year? Oh, wouldn't that be wonderful? I don't have that kind of crystal ball. I wish I did. And I know the task force members wish they did too. Wouldn't we all love to be all together? So we're just gonna have to keep an eye on how things are going, how many people have been able to get vaccinated, where we are with herd immunity in Forsyth County, and we'll just continue to make those calls as we move forward. It is early this year. It's Labor Day weekend. The one year we wish it was later in the month. Unfortunately, it's earlier in the month, so it doesn't even give us that extra 3 to 4 weeks. So we'll just see as we move forward. But thank you for that question. Bobby, yes, will singing be allowed outdoors? I don't know how to answer that one. Dr. Mizell, what's the thought on that?
Right. So, if people are very close to one another and are really belting out, Ein Kelohenu or something, then I think and they're not masked, it could be a bit of a problem. But if we have good spacing and people are willing to sing softly, I think it would be possible to enjoy the pleasure of each other singing. Clearly not mine, because I can't, my wife says I can't carry a tune in a suitcase. So I think it's possible. It's just we're going to have good spacing and people recognizing that they're going to have to do this at a low decibel level, because the strength with which they sing will have an impact on what they release. So it's possible. We'd have to talk more about it at our meeting.
Thank you. Any more questions? I don't see any hands. What about handling of prayer books at services? Again, that's part of the logistics. My gut is that we probably will not have the prayer books out, but again, that'll be part of the logistics that you'll receive in the very near future before we open April 16th. Any other questions? Again, thank you so much. You know, as we said, it's been a year since we started this journey of physically distancing and masking and seeing our friends and community on virtual platforms and watching the COVID-19 metrics as they dictate our ability to return to what was once considered quote unquote normal. This is a baby step, and I'm grateful that we're going to be able to take this baby step and together, if we do it well and do it safely, hopefully we'll continue to progress. I thank all of you for coming tonight, and I wish you all a good evening. Thank you.
Thanks, everyone.